Is it okay to pass these around?
Thank you.
Wow. Yep.
I'm John. 8 months out of surgery last May. Since then, it was 295 at surgery. I'm down to 195 now. I'm worried about it too fast.
You could be. That's always a possibility. With your other issues, you could get too thin. If you do, the nice thing about the surgery is we can revise it in 30 minutes. Be happy to do that. In other words, you call me one morning, we can do it that afternoon. It's no longer, if you think about it, really than having your teeth cleaned. So if you get too thin, or if your wife you think is a little too thin, we can revise it in 30 minutes. It's just not a problem at all.
Well, now it's like I was figuring like 185, but I think I'm there already where I want to be.
Okay. If you lose too much, we're just a phone call away, and it can happen. We have had 32 people out of 4,000 get too thin, so it's not very often. And as you get to a year, you can sometimes have a little bump back up. But if you feel uncomfortable, if he's tired, it doesn't feel well, anything at all, or you just prefer to be a little bit heavier weight,
I've been eating like a pig.
that's good. Good. Yeah.
Is the cost like teeth cleaning as well?
Yeah. It's a lot like a root canal. I think it's $14,000 for a revision. So it's terrible if you have to have it on the other financially.
So that's just the intestines you may put back.
We would shorten it up, right? In other words,
You don't touch the stomach anymore.
well, we would talk with you. It depends on the patient. We have a lot of options to modify it. It's real easy to do. There's a video of it on the website, and it takes about 30 minutes. So if you think you're losing too much, just let us know. We'll fix it.
Well, I'm thinking maybe it's because of the treatment that I had.
Well, I didn't want to comment on the video, but since you have had other medical treatments, that once you get through that could make a difference.
That's
and
finished.
Yeah, once you get through that, I would watch. How long have you been off the other treatment?
2 months?
Almost.
2 months.
Yeah, I would give it 6 months after that before we know whether the other medical treatment has contributed. But you could say tomorrow, I'd like to revise it. Whatever you say, we can do.
A lot of gas.
Gas. Let's talk about. I'll give my gas talk. All right. So let me talk about gas. It turns out that there are a variety of foods that if you eat them, they get digested and they go onto our tummy, our hips, neck, and that causes fat. And so high-fat foods, high-protein foods, things like that. And when you come to me, you say, Dr. Rutledge, I don't want that extra tummy, extra hips, extra neck. And so we interfere with digestion and absorption of fat. Now that's okay because you get thinner, okay? But the risk is that when you leave that undigested fat in the gut, it goes down into the colon and then it causes gas because the bacteria in the colon eat the fat you don't eat. And that makes a lot of gas. Okay, so one way to avoid that is eat less fatty foods. Okay, another thing is that for you to digest dairy products, you have to have an enzyme that chews up the lactose sugar, and that enzyme is called lactase. And so if you eat dairy products and you don't digest the lactose, the sugar will stay in your gut and the bacteria will digest it into gas again. And that will be unpleasant. So another thing you can do is decrease your dairy foods, or you can take a tablet that has the enzyme in it called Lactaid that you can buy at the grocery store. So if you want to have dairy products like cheese or ice cream or milk or things like that that have a lot of lactose in it, you can get some Lactaid and that will help. So those things can cause gas. And if you're having a lot of trouble with gas, write down everything you eat for a couple of days and mail it to me, and I'll give you some pointers.
Okay. Next thing, HGH.
Yes.
Is it possible to take HGH?
Yes. Ask Barry Bonds.
No, is it legal?
I would talk to your doctor, but HGH or human growth hormone is something that goes down in men as we age. Not me, of course, but I mean other men. But,
To fill in areas where
it'll help build muscle.
Shrunk up.
Yeah, especially after your other therapy. If you discuss it with your doctor, he can measure some tests, and both testosterone and HGH are anabolic. They are muscle building. Remember in the manual we have some supplements, whey protein and creatine and glutamine. Do you remember those? Are we taking those now?
No, but we will.
Okay. But before I did something more dangerous, like the HGH has some side effects, I would take those supplements regularly at high dose because they build muscle and they build strength and they will help put some weight on after your other therapy.
Okay, when you do those, do you take those after you work out or before you work out?
Ooh, boy, there's a big controversy about that. In fact, you can take it both. You can have a little bit before, a little bit during. There's actually some recent research, instead of spending all this money on getting to the GNC store and buying the special proteins and all the rest of that, you know what they say now? They did a study at one of the research centers. They said they just drank skim milk post-exercise. And they found that had a pretty good mix of proteins in it. Yeah. But now you could have a problem with skim milk because of the lactose, so you could fix that by the lactate or getting some lactose-free milk that's called lactate milk.
Everything else is fine. Went played 18 holes of golf, no problem.
Wow.
You know, I haven't done that in years.
Oh, really?
Yeah,
Good.
enjoyed that. Can't wait to get back out there and do that again. Did bowling every day, almost every day bowling, lifting weights,
Really? Good.
trying to get the muscle back.
Yeah, well, take the supplements. That will really help. The creatine in particular, it's inexpensive and you can it really helps build muscle. And also, they did a study in us older men where they gave creatine to older men in nursing homes and then gave them puzzles to solve. It actually improved their brain function. So the creatine supplement I take all the time and I forget why. No. It's a good thing.
Everything else is fine.
Good. Thank you very much.
Thank you.
You look great.
Thank you.
And any questions?
I have a question.
Yeah.
We raise dairy goats.
Yes.